Oncology.TV here at the 2011 ONS conference in Boston, Massachusetts. Delighted to have back with us Carmen Jacobs. She is the research nurse supervisor in the Gastrointestinal Medical Oncology Department of the MD Anderson Cancer Center in Houston, Texas. Nice to see you again.
Nice to see you too.
Let's talk about the work that you do, Carmen, in neuroendocrine tumors. When you get patients, it's not always a great start for you in MD Anderson. You've got some pretty heavy lifting to do. Can you talk about that?
Sure. The problem is that with neuroendocrine tumors, they're usually very indolent and their symptoms are so vague that by the time they are diagnosed, they're usually metastatic. So we have a patient that's already in the metastatic setting, so their prognosis is different than if he had been catched earlier on. So that is usually the problem. So, however, at MD Anderson, we are very lucky to have clinical trials for our patients. And most of the clinical trials that we do are for metastatic patients. So then we're able to offer that as well as the other treatment, which for neuroendocrine tumors, there's not much to offer that has been accepted for neuroendocrine tumors.
These types of tumors are so hard to detect. There's a real need for education and awareness. Carmen, do you feel like you're working in an area in cancer research that's still kind of under the radar?
Absolutely. Many of the treatments that we have right now for neuroendocrine tumors are really treating the symptoms, but not really to treat the cancer to make it shrink or anything like that. I mean, even neuroendocrine tumors, they're divided into mainly carcinoid or islet cell or pancreatic neuroendocrine tumors, meaning that they arise from the pancreas, whereas the carcinoids can arise anywhere else in the body. And they are treated very differently as well. Actually, the carcinoids, it has not been shown that chemotherapy works on them. And in some of the pancreatic neuroendocrine tumors, some chemotherapy may have shown to have some effect, but still it's very early on. We're still doing some clinical trials, and hopefully we'll get something soon that could help this patient population.
What would be the primary form of treatment for each of these two types of tumors?
Actually, for the carcinoids right now, it's mainly symptom management that we have. Of course, there are some clinical trials going on trying to see if some of these drugs also can shrink the tumor. So there are clinical trials going on trying to see that if some of the drugs that are already being used for symptom could work to shrink the tumor. And then there are some other drugs as well that they are treating to see if they really shrink the tumor or at least give a better prognosis to the patient or delay the disease. Because it is still a metastatic cancer when we catch it, so more than likely we can shrink the tumor, but so far we have not seen it disappear.
Despite the lack of widespread awareness about neuroendocrine tumors, behind the scenes there really is great promise, both in terms of clinical trials and drugs. Can you talk about that?
Absolutely. We have many clinical trials going on at MD Anderson for neuroendocrine tumors. There are many more in the horizon as well. They're continuously, the physician I work with, Dr. James Yao, he's continuously always looking for more drugs and more opportunities to treat the patient with different drugs and different ways of approaching these cancers. We're continuously learning more about the disease, about how it really behaves, or what type of where in the cell cycle can we just then do something for the disease, and then looking at the different pathways that there are now with the different drugs to really see what's really going to work for this type of cancer.
Meantime, what's the best thing that you can do for these patients? What do they seem to need the most? Because the fact that it hasn't been detected early probably has many of them, I know, scratching their heads saying, where did this come from and why wasn't this caught before?
Actually, that's a good point. I think most of the patients, I think the first thing is we need to show them some empathy. The patients come in maybe being a little bit distrustful because for so long they've been going to different doctors trying to find out what was wrong with them, and nobody would tell them what was wrong with them, or they misdiagnosed them. So by the time they come to us, we need to reestablish that trust. We need to see that they really believe that then we finally think we know what's going on with them, and that we're going to be able to give them some hope as to symptom management or even also to treat the disease.
Carmen, thanks for spending some more time with us. I appreciate it.
Thank you. It was my pleasure.
Carmen Jacobs from the MD Anderson Cancer Center in Houston, Texas, talking about the latest with neuroendocrine tumors here at the 2011 ONS conference for Oncology.TV.